Hey guys, it's Cameron Bailey with the Crabtree Group, and today I want to talk about something that I get asked quite a bit, and that is, Cameron, what is the proper way to take a new patient intake call? Or what advice would you give me for someone that's on the phone with a new patient? What type of scripts do you have, or what type of scenarios do you come up with? And, the most important thing is I don't really believe in necessarily having a script. But what I do believe in is you've got to get very, very good at asking open-ended questions. Open-ended questions begin with what or how. I never want to ask a closed-ended question that is do you, did you, will you, won't you, that I can get a yes or no answer to. Because I'm not bringing the patient to a new realization when I ask those types of questions. The other thing that is very, very important is the person that's asking the questions is the person that's controlling the conversation. So if the patient is the one that's actually asking you the questions, then they're controlling the conversation. So you've got to get good at not answering necessarily directly to the patient, but you want to answer with an open-ended question. So for example, if a patient calls and says, yeah, I wanted to know what you guys charge for a cleaning. Well, rather than just give them the price right then and answer the question, I want to ask an open-ended question to get back control of the conversation. So I might ask, great, who am I speaking with? Oh, well, this is Jim Johnson. Hey, Jim. So, Jim, how long has it been since you've been to the dentist? So I'm immediately taking control by asking the question, and it's an open-ended question, so I get the patient talking to me to give me the information that I need to qualify them for what visit they're going to be for, whether it be a full comprehensive exam or a limited exam or a cosmetic consult, whatever visits that you have in your office. You want to be really, really good at qualifying the proper patient to fit that proper visit. The other thing I want to qualify the patient for is I want to make sure that I'm asking the questions that is bringing the patient to the proper realization. Everybody has had this scenario where you have a new patient come through the door. They're there for a cleaning, but we didn't properly qualify them on the phone. So then when we find out they need $20,000 worth of work, they blow out the door. And we spend a bunch of time and a bunch of effort, and we don't close the case. The intake call is the first impression of the practice, and it's the first step in creating consistent treatment acceptance. So I want to be very good at qualifying the patient and bringing them to the realization that, they could need some work. So the way I do that is I'm asking questions so that the patient brings their self to that realization. So if I find out the patient hasn't been to the dentist in 10 years, and I find out that they have a lot of sharp edges and cracks in their mouth, and they've got a lot of sensitivity, and they're bleeding, and they're missing teeth, I can ask open-ended questions to find out, number one, their dental IQ, right, where they stand as far as what they know about dentistry. And if I'm really, really good, I can find out more of a financial IQ as well. So, for example, some of those questions might be, so, John, have you ever, how have you handled investments beyond what your insurance has covered in the past? Have you ever had a have you ever had a payment plan option presented to you, John? All of these are open-ended questions that John can now kind of learn to take some ownership, and he comes to the realization that, hey, I might need a little bit more than just the cleaning. I might have some treatment that needs to be diagnosed. So I'm trying to bring John to that realization to qualify him so that he's able to understand that what our expectation is for this visit, and it matches his expectation. Remember, creating the expectations is what we're trying to do on the intake call, and it's very, very important. So, guys, if it were me, and the advice I would give you is come up with a strategic list of questions, okay? Not a script, but a strategic list of open-ended questions that you guys can use when you're on the phone to bring the patient to a realization. Bring the patient to the realization that A, I might need some work, and B, it might cost some money. So, guys, I hope I helped. If you have any questions, please call us, send us an email. I'd love to hear from you guys. Hope you're having a great week, and we'll talk soon.